I need your advice on vaginal discharge after hysterectomy.
It certainly shouldn't include blood, since you can't have a period anymore.
I know any blood after a hysterectomy means something is broken, well bad. But I've heard there could be some
brown vaginal discharge for a couple of weeks after a hysterectomy is normal.
I thought it would only last a few days.
The red bloody discharge as incisions heal is only a few days, while the brown dried blood can leak out over weeks.
So even without a period, I have to wear maxi pads for another month or two.
Don't use tampons.
I know, they recommended against that, even with the expected discharge.
If you lift anything heavy in the 6 weeks afterward and get a rush of blood, get to the emergency room because you tore something.
They gave me the same advice as when you have a kid, don't lift anything heavier than a newborn.
You can have bleeding because you tore things having sex too soon after the hysterectomy too.
Let's just say surgery and vaginal discharge like this are the exact opposite of the mood required for that to happen.
Any spotting with a bad odor, though, is a reason to see a doctor. Even if it is a really bad yeast or bacterial infection, it needs to be treated.
So the standard yeast infection with a beer smell is really bad right now.
Yes. And a thick white Kurdish material coming out from an infection is also really bad.
What other discharge should I be on the lookout for?
Any thick yellow drainage is a possible infection of the surgical wound, so you need to see the doctor about that. Ditto if you can't pee or poop.
I'd certainly see a doctor about not being able to go to the bathroom.
A warning sign is when it hurts to do so.
They tell you to have laxatives and lots of fiber to reduce the straining down there.
If it burns when you pee, that's a urinary tract infection, but it could mean other bacteria are in the incisions. And green and yellow discharge from the vagina means there definitely is.
So even though I can't have kids, I still get a few more weeks of looking at the multicolored diaper pad insert.
You are supposed to talk to the doctor anytime there is bleeding heavier than light spotting and any discharge that has a bad odor. If in doubt, ask the doc.